Can you introduce yourself?
So my name is Dr. Katsuura, or Dr. Yoshihiro Katsuura, and I'm an orthopedic spine surgeon in Northern California.
Can you tell us a little bit about osteoporosis? What is it?
So osteoporosis is a very common condition. It starts to affect essentially everyone as you get older. And what it means is the bones become thin and weak throughout your body, and it affects certain areas more than others. And those are the weight-bearing areas of the body, such as the hips and the spine in particular. Bone loss occurs at a rate of about 3 to 5% per year from the age of 30. So your bones continue to get stronger up until around the age of 30. You continue to build bone mass. And then from the age of 30, you undergo this steady decline where your bones become thinner and thinner and thinner at a pretty predetermined rate. And vertebral compression fractures are very common, and they occur at an incidence of about 700,000 per year in the United States. So roughly every 22 seconds, someone in the world will experience a vertebral compression fracture. And the condition is much more common in women because women undergo menopause, and when you undergo menopause, you have this decrease in your levels of estrogen. Estrogen is a hormone that's responsible for maintaining your bone health, your bone mineral density. And so once you go through menopause, you start to have an increased risk of osteoporosis, you have an increased risk of osteoporotic compression fractures.
How do compression fractures affect your overall health?
So compression fractures can affect your health in a number of ways. The most obvious way is you have increased pain. So all your daily activities become more difficult, getting in and out of bed, going to the bathroom, sitting up at a chair, walking, those are all more painful. So because you have more pain, you're less likely to actually get up and move around. Because you stop moving around, you're walking less, your mobility is less, you use your body less, you start to deteriorate at a pretty rapid rate. You lose muscle mass, your bones become even more brittle because they're not being used to bear weight. And some people can undergo a very rapid decline after having an osteoporotic compression.
What are some non-operative treatments for compression fractures?
So some compression fractures don't require any treatment, and they get better with time. Some people might not even go seek attention of a doctor. They might think they have a bruised spine or a muscle strain or something like that. And ultimately, these fractures can heal on their own. But when patients present to the doctor, the emergency room with back pain, we generally offer them various non-operative treatments as a first-line course. Those would include things like physical therapy, mainly just to keep them active and moving and using their body instead of becoming deconditioned when they have one of these fractures.
What are some operative treatments for my compression fractures?
Workhorse of those treatments is cement augmentation, where we actually use a special bone cement, polymethyl methacrylate, to stabilize the fractures. And there's various forms that you can do cement augmentation. So traditionally, we would just stick a needle into the spine and inject the cement. That's called a vertebroplasty. And that was an older type of cement augmentation, and we don't really use that as much anymore. Instead, now we use what's called a kyphoplasty. And a kyphoplasty, the needle is inserted into the vertebra, and then a small balloon is inflated, and that creates space for the cement to go, and actually can help sometimes reduce the fracture or recreate the normal geometry of a vertebra. So that's called the kyphoplasty when you do that. And now there are even more advanced techniques that can be used, such as the implantation of these small expandable devices called spine jacks, and they can even further or with even more power recreate the shape of a normal vertebra.
What's involved during a kyphoplasty procedure?
So in a kyphoplasty procedure, you're put on your stomach, and so you're facing down like this, and then the surgeon will localize which vertebra is broken using x-ray. So we'll take an x-ray and figure out which ones are broken based on your pre-op imaging. And then using the x-ray, we take a small needle and we direct it into the vertebra. and we watch exactly where it's going based on our x-rays. And then once the needle is into the vertebra, we have a little syringe that we can actually use to inject the bone cement, and we can see it going in under live x-ray.
How long does the procedure take?
A kyphoplasty procedure generally takes me about 10 minutes to do. Most of the time is in the setup for the procedure, so getting you positioned on the operating table, getting your back prepped and draped in a sterile fashion, and then bringing in the x-ray machines so we can pinpoint exactly where we need to do the procedure. The procedure itself is actually quite straightforward and simple, and it's literally just injecting a little bit of cement into the vertebra. It doesn't take much time at all, maybe 5 minutes.
And what's the recovery?
The recovery is essentially immediate after a kyphoplasty procedure. The procedure either works or it doesn't. So if it works, then you'll notice immediate dramatic improvement in your pain. For some of those fractures that are more chronic, kyphoplasty may not offer as dramatic of an improvement. And that's one of the risks of the procedure, is that it just doesn't work.
Do kyphoplasties work?
So kyphoplasties are very successful. There's a lot of evidence regarding this now. If the fractures are old or chronic, the kyphoplasty is not as effective. So if you have an acute fracture, kyphoplasties are much more effective than if you have a chronic fracture. So if your fracture is older than 6 months, kyphoplasty may not work for you. But in general, for an acute compression fracture, kyphoplasties are very, very effective, somewhere upwards of 90% success rate in relieving the pain from your vertebral compression fracture.
What are some complications for the procedure?
So in general, the procedure is extremely safe, and I rarely ever see complications from it. Most of the complications that occur are not the result of the procedure, but just the result of the overlying condition, which is osteoporosis. So just because you do kyphoplasty at one level doesn't mean that you can't get a fracture at the level above, or even a level at some other area of your spine. So ongoing compression fractures at other areas of your body, especially if you have your osteoporosis caused by some other pathologic condition, is a risk of the procedure. So other complications related to the kyphoplasty procedure are related to the injection of the cement. And so when you inject the cement, it displaces the bone marrow in the vertebral body, and the bone marrow can embolize and go to other areas of the body. And if it goes into the lungs, it can cause what's called an embolism. So that means blood flow is blocked off to a certain part of your lungs. The cement itself can leak out of the vertebra when you're injecting it. That's actually fairly common, and most times it's totally benign and it does not cause any harm to the patient. But sometimes it does, especially if it leaks into an area where there's sensitive or critical structures. So if it leaks back from the vertebral body into the spinal canal here. That's where all your nerves and spinal cord are, and that can cause a neurologic injury, which can be catastrophic, although that's very rare, and that's something that we pay very close attention to during surgery. If that's happening, then the procedure is stopped immediately.
Would I be able to go home the same day, or do I have to stay in the hospital?
A kyphoplasty is an outpatient procedure, so almost all patients, unless you're already admitted to the hospital for some other reason, would go home the same day after the procedure. You have a small bandage over the insertion site of the needle. That can be removed the next day after surgery, and you can shower normally. And then I just tell all my patients to avoid any heavy bending, lifting, or twisting after the procedure, just because you wouldn't want to aggravate it or stir up a new fracture, which is very common in people with osteoporosis. So just taking it easy for the next couple of days after a procedure, I think, is really important.